won't always need an entire care team for every health concern. You may only need a doctor or a psychologist or a physical therapist. No more having to research and find each type of provider on your own, or go to one appointment only to be referred to another one. Let's take a closer look at each member of your care team. Your primary care doctor is your care team leader. They are board certified and manage all the health concerns that a typical primary care physician would treat, like sick care, maybe you have strep throat, routine care, you need a yearly physical, immunizations, and helping to manage chronic illness like diabetes or hypertension. You have your own mental health expert. Crossover psychologists and licensed therapists who make up our mental health team are keeping very busy these days with mental health needs reaching epidemic levels in the United States. That's why it's important that Crossover members are able to get a face-to-face appointment with a licensed mental health provider in just 6 days. Compare that to waiting 48 days for a mental health appointment in the community. These compassionate professionals are able to treat a wide variety of mental health conditions and have diverse expertise across the team. Sessions are goal-focused and time-bound to promote resiliency, independence, and to build autonomy, and it can be delivered in individual or group settings. From anxiety to addiction, from sleep to suicidal thoughts, from burnout to behavioral disorders, this team is making a meaningful impact on many of our members' lives. In times of COVID, we've increasingly helped people cope with their loneliness, grief, and relationships. Next, we have your physical therapist. Pain is your body's way of telling you something is wrong. Yet there's not always a clear path on getting care for pain, or let's face it, it just takes too long. Many people wait or hope the pain will go away, and it only gets worse. That's why your care team includes a certified physical therapist to support your bone, joint, and tissue health. You can schedule directly with your Crossover PT without the need for a referral. The PTs are working with many of our Crossover members who work in warehouses or distribution centers and whose jobs depend on their physical strength and their mobility. They're also working with office workers, improving ergonomics, headaches, and stretching. And then there are our weekend warriors, the DIYers, and the marathon runners. The body is made to move, and this team will keep you moving, pain-free. Your PT can work closely with the fitness coaches on staff to treat musculoskeletal conditions, reduce pain, improve your strength and your mobility. I, for one, love to talk about the health coach on your team. You don't have to be sick to work with our care teams. Many of our members are motivated to live a healthy lifestyle and strive for complete well-being. And coaching is the perfect service for this. Crossover's health coaches are health experts like registered dietitians, but they have education and experience to help guide you to achieving your personal health goals. These goals might include weight loss, nutrition planning, quitting smoking, sleep health, and mindfulness. Our board-certified health coaches will help you set your goals, chart out a plan, try new strategies, check in for accountability, and cheer you on for as long as it takes. We partner with your doctor, and we also work very closely with Crossover-certified fitness coaches. Those fitness coaches can help build tailored exercise plans, record your biometrics over time, and track your progress. They also lead online and live fitness classes. There's yoga, strength training, high-intensity interval training, there's cardio, and there's other classes to choose from. And they are free, so you can afford to mix it up from time to time. There is a dedicated referral specialist working hand in hand with every care team. We call them care navigators. They are ready to assist you in receiving the most appropriate, high quality, and affordable care in your health plan's network, and community resources and support. They'll coordinate the paperwork and the communication between community specialists and crossover so that you don't have to. They'll help you make appointments and can help answer any questions you may have about the process, next steps, and cost. If you're getting crossover through your employer, our care navigators will know of other benefits or resources made available to you by your employer, and they'll direct you to those should you need them. We know care coordination needs are very different. Our members have received care navigation support in many ways. They've asked, will my health benefits cover a sleep study? Can you help me find the right providers, appointments, and records for my cancer diagnosis? How can I find housing options in my community to keep a roof over my family's head? Can you send my labs to my dermatologist? This, again, is how Crossover strives to make your entire healthcare experience as seamless and as easy as possible.